Hello, I'm Dr. Shel and welcome. Today we're going to talk about leaky gut syndrome. I am pretty sure a lot of you have by now heard of leaky gut because everybody's talking about it, and it's something that is really pertinent to our medical system today. Most traditional doctors are now starting to open up to why the gut is so important in chronic diseases. Leaky gut is a condition in which your intestinal permeability changes. So what that means is undigested food, toxic waste, other products that you really don't want into the bloodstream is now entering into your bloodstream and wreaking havoc. And when I say havoc, a lot of chronic diseases we're seeing now, especially neurodegenerative diseases, chronic fatigue, chronic constipation, diarrhea, what they call IBS, Crohn's, ulcerative colitis, poor immune system, rheumatoid arthritis, excessive fatigue. A lot of us have excessive fatigue these days. Headaches, brain fog, memory loss, skin issues, problems such as acne, eczema, rosacea, cravings, constant cravings for carbs and sugars, arthritic or joint pains, depression, ADHD. I've basically talked about everything, because everything seems to be related to our largest organ, which is the gut, causing a great deal of havoc in our bodies. So let's talk about it for a second. Leaky gut is something we need to know about. We need to know that the gut microbiome plays a huge role in everything that we do on a daily basis. And if the gut microbiome is not where it needs to be, it will eventually lead to leaky gut syndrome. And we are going to have toxicities in our bodies which we do not want, and we don't know what to do with it. So what do we do about it? Well, first of all, we see tons of patients with gut issues and leaky gut. And so where we start off is a very comprehensive history to see what kind of eating habits they have. Are they hydrating? What kind of stress are they under? Have they done a lot of steroids in the past or antibiotics for reasons that they thought was out of their control? Have they had poor dietary or poor sleep hygiene? All of those things are very important. So once we do the history, we like to do a very full, wide range of testing that will test candida, that will test your food sensitivities, that will test nutritional deficiencies, as well as perhaps stool testing if there is a lot of chronic diarrhea going on. Once we look at those testing, and prior to even getting to the results, I always like to make sure my patients are off of the inflammatory foods. The inflammatory foods that we know affect most of us are gluten, sugars, dairy, soy, and a few other things that we like to get people off of right away. We like to get their hydration up, so we like to recommend the 14-day detox that I've researched tremendously, and it is one of the best out there because it's going to cleanse your body but not put your body into shock where you're going to sit in the toilet all the time, which is not what you want. So it's a gentle but effective detox. So we start with that. We then build upon that by doing the right supplementation to rebuild that gut lining. We can do that with things like glutamine. We do the right doses and balances of digestive enzymes, of protease, the right probiotics in the right doses. Perhaps if the candida is high, we may add some oil of oregano, some caprolax, and then the list goes on and on depending on what is going on. And that's what we'll determine in the testing. So once we do that, it's amazing. Just within weeks, patients start feeling better. They start getting their energy back. They start sleeping better. They don't get sick as much anymore. Their joint pain gets better. Their chronic constipation gets better. So many things in their life changes. And with that, they're less stressed, they're sleeping better, and they're just overall more healthy. But we don't really stop there because you need to then build upon that. The gut is the foundation of what's going on in your body and with your health. So we make sure that that leaky gut is definitely addressed, and then we build upon it by really coming into the picture with hormone replacement, adrenal balancing, nutritional balancing, and so many other things, but those things are very customized to what the person needs. So if you have any of the symptoms that I described that may be related to leaky gut, I would highly recommend that you go to www.drshel.com, that's drshel.com, do a self-testing. We have a lot of completely complimentary testing that you can do, and you can then realize if you do have some gut issues, some candida overgrowth, if you may have adrenal imbalance or hormonal imbalance, thyroid imbalance, and then let us help you customize a plan for you so that you can feel your absolute best. But remember, the gut is where it all starts. So make sure you pay attention to the gut and start learning more about leaky gut. Thank you.